Shalom and welcome. This is my patient story. Take a look. Living past my expiry date. My name is Pelio, a Kenyan female information specialist with a problem gut known as IBS, that is irritable bowel syndrome. A troubled gut equals a troubled human with compromised quality of life. IBS basically means some foods trigger digestive reactions, which is not fun at all. Symptoms go from constipation, bloating, rumbling, acidity, changes in bowel size, bowel movement inconsistencies. In my case, constipation was the CEO, the head, their mother in quotes, moving from one end to another extreme of diarrhea. When others do bowel movement on demand, for IBS, it's like a project where you have to do a proposal or perform rituals like tummy massages, skipping, doing walks, or doing several liters of water, and the list is endless. Many times I suffered hemorrhoids, which comes as a result of strain on blood vessels in the rectum because of frequent constipation. Sometimes I had to resort to manual excavation. Sounds gross, but yeah. My symptoms started long as I can remember, but I didn't give it much thought. I remember as a child, certain foods like raw peanuts could not be taken the same day with small fish known as silver cyprinid. That spelled trouble for a couple of days. Medical gaslighting. My case. 2 weeks of prior booking, the long-awaited day had finally reached. I started my journey in the wee hours, boarding 2 public vehicles plus a motorcycle to reach the hospital in time. I wanted this case over and done with. I walked into the clinic. I was the first patient. It was on first-come, first-served basis. I paid the consultation fee, file opened, and a few minutes later, I'm ushered into the doctor's room. Armed with a notebook and a pen, I state my problems. He jots down. I ask questions. I write my notes. A few minutes later, 5, 6 or so, he drops his pen, leans forward, and says, "I think your case is psychological. Leave." He gestures me out. "See you sooner or later," he adds. He moves slightly backwards on his swivel chair. Phone calls his receptionist. I panic standing. He gestures me out again. Tells her to refund me. A well-built guy, tall or huge. I remember the saying, amri ni kubwa kuliko mwenye kutoa. Translated, a command is greater than the commander. The command is like a punch on your nose that leaves you in a dizzy, confused state. I finally got out and the receptionist blasts. "Kwani mumefanyana nini?" Translated, "What have you done with each other?" Better yet, what happened? She takes back the receipt, hands me back my money, shreds the receipt, cleans her hands, or rather wipes her hands with a white cloth towel, meaning case closed, or if you like, case buried. Rest in peace. I felt like a loser. Money back, problem unsolved, time wasted. Anxiety wasn't. My cash on my right hand, problem on the other. That was a classic case of medical gaslighting, which is a behavior where a physician or a medical professional dismisses or downplays a patient's physical symptoms or attribute them as psychological. His words, "sooner or later," stuck in my mind. Is it my note-taking and myriad questions that intimidated the doctor? I don't know. Sooner or later? That meant I had to come back to him? I doubt. So I bought a public vehicle back home. It was a GP. Does it mean great physician? No, a general practitioner. God is the great physician. With my disaster preparedness mind as an information specialist, I start a daily record of everything that I consume. That included snacks. I later learned that it's called a food journal, which I intended to use during my next doctor's visit. So I kept it meanwhile using antacids, painkillers, and warm drinking water to ease my symptoms. Allow me to introduce to you two personal records that helped to direct or steer my diagnosis by the grace of God with cooperative doctors. The records I made that helped pin down my problem. The first being a food journal, the second one being a personal medical records book or medical journal. Another two will be discussed much later in this video. Food journal. This is a sample of simple food journal that anyone can keep. The columns include date, time, food eaten, and remarks. On the remarks is where you record your feeling during, after, and later up to the bowel movement point. Examples of remarks include happy, restful, sleepless, bloated, gassy, etc. Over time, you're able to identify problem areas or with the help of a doctor or a dietitian. I forgot to mention, the process of writing this journal is called logging. To note, during the journal making period, I noticed that spices caused a lot of rumbling, acidity, or acid reflux that later was diagnosed as GERD, that is gastroesophageal reflux disease, and I struck them off my ingredients list. Or is it my elimination protocol? Hence, my spice-free meals evidenced in my daily recipes in this channel. In a bid to tame IBS and other health challenges, I was treated for constipation. Esophageal husks, I think they were for fiber, anal suppositories, and ointments. However, these were not treating but managing my symptoms. Yet, I yearned to catch the culprit, to know the root cause of my problems. Later, I realized wheat or gluten caused my constipation flares. It literally behaved like cement in my case. No bowel movement for several days. And when it comes, like after a bowel movement feels like you're on vacation. That's how serious it was. Medical journal or sick record. This is basically how mine looks. Sorry, it's in a pathetic condition, coming apart since 2013. I do the same for my family members from the other end. So these are my doctor's telephone contacts, my personal details, which include name, date of birth, nationality, county, contact persons or next of kin's telephone numbers, your blood group, drug allergies, food allergies if any, and maybe chronic illnesses if any. It has columns as shown: date of visit, diagnosis, drugs prescribed, the doctor, and hospital. I feel like everyone should do this, even if it's recorded in your native language. Everyone. I have bought a new notebook. We'll find time and transfer everything, so don't mind. How my medical journal helped steer my diagnosis. Excuse me. I remember one Friday on a regular check with a gyno. I think I went for an annual pap test. Armed as always with my medical journal, I had marked something that had recurred or was recurrent and treated with strong antibiotics, cleared, and life went on. Fast forward, it's a case for concern. Abdominal scan is done plus pap smear. I'm forwarded to a nephrologist, a gastroenterologist, that's a kidney specialist. The nephro is a kidney specialist, and a GI surgeon. Booking slots checked. Luckily, I have same-day appointment for both. Armed with my abdominal scan done earlier, the nephro says it's not clear and requests for CT urography. He flies out of the country. CT is a computer tomography which uses a special contrast dye injected intravenously or through the patient's veins to give proper images of internal organs. I remember immediately I was injected, I felt I was turning into a stone. I board a vehicle back home after the scan. 3 hours later, 80 kilometers away from the hospital, I react to the contrast dye. Bear in mind, it's my first. There are red rashes all over my body, and the worst part is shortness of breath. I literally felt like a pillar of salt, like Lot's wife in the Bible. At this point, I'm convinced I'm dying, so I call up my mom, and I only manage to say, "I love you, Mama," because I didn't want her to say I did not bid her farewell. I call my husband, explain my predicament, meanwhile lying on a mattress on the floor to die, because I didn't want to struggle. When it's time to die, the best thing to do is to just die. But he advises oral hydration, lots of water, and it works. Subsequent visits, time for results. Nephro and gastro meet to discuss my results and management plan. Gyna says pap smear normal. Nephro sees compromised kidney, or is it nephrons? I can't remember. Urine reflux affecting urethra, but basically says a urologist best placed to handle that case. Gyna, nephro, uro, and GI surgeon. 1 patient, 4 doctors. At this point, there is so much to do with limited time, and I'm desperate to live or in dire need for a new lease of life. So, urologist requests a series of tests: pathology, full hypo, thyroid function and a serology, renal function, urine protein, UEC, urine protein creatinine ratio, Helicobacter pylori, complement C, complement 3, complement 4, rheumatoid factor, ANC, or is it AND? I don't know. I'm tired, guys. These doctors spent their whole life studying to help humanity. I appreciate all doctors from the 6th basement of my heart. Fast forward, my flight arrives. It's just a wheelchair. Ama tuseme Uber ndio muelewe. Booked for exploratory surgery for the GI, that's endocolo, and the uro, I don't know the term, urologist, I don't know the term. Vitals not okay, as anxiety lands full force. It's my first again. PICC lines collapsed. I'm on nil by mouth or forced fasting. Can you imagine? A foodie. That's worse than corporal punishment. Anyway, that passed. Full digestive system cleanse, or is it irrigation? plus lots of hydration. 3 days on, I fly to theater. 5 hours later, woke up with a slight sore throat, a catheter, antibacterial and pain management, IVs, that is intravenous, where medication is through the veins. Biopsies sent for further investigation, E. coli, and some slight infection on sigmoid rectal area. Bladder urethra had serious issues which were dealt with head on. 3 days discharged with more antibiotics for oral administration. 1 month later, I'm back for biopsy results. No issues. Urine protein creatinine confirms bladder doing fine. No thyroid problem. Meanwhile, food journal logging continues. Having eliminated spices and gluten, another catch. Deep fried fatty foods cause chaos. For IBS-C, that is constipation, I resorted to full-time okra water, a glass every hour, and ground flaxseed to powder, which I use in smoothies and baked gluten-free goods. Jump forward, a year plus or so later, constipation somehow is tamed. Because through the food journal, I have made several adjustments. I'm fine until it's time for bowel movement. Like what? Like, how do I put it? Like wax, kind of wax? Mshumaa kwenye kaa. Wax on call. The rectum is on fire. Sitting straight for an hour is close to impossible. And if I do, my feet numb. Remember, my weight drops, unintended weight loss, anxiety increases. I Google about hemorrhoids, they don't make sense. My gut instinct says something is not right. As Dr. Paul Manikam puts it, when the gut speaks, your brain listens. Your gut is your first brain. Trust it. Something has to be done. I have to be my own advocate. So, fight mode on. I pack my ID, my emergency card, previous scans, and hospital records, my food, and I set off to war. I casually walk into a health facility, request a referral, a GI surgeon, but first, I go bald. I shave off my crown, ready for a head-on collision with a charged rhino. The C word, that dreaded word, because I had episodes of blood in stool and mucus too. So my mind pins it on colorectal cancer. I'm literally facing death. I'm dead. But wait. My story continues. At the patient's lounge, see my uneasiness. I'm the next patient. So I go in. With the help of my medical journal, I remind the doctor of what was previously done and drugs used plus the dates and the year. That doctor, an easy guy who lets you go from nonsense slowly with questions and jokes in between as you learn until you both arrive at medical sense, if that makes sense. As always, with my notepad that had a checklist of my what ifs and a pen to learn more, He does physical checks, hemorrhoids already healed, scribbles a request sheet and says, "Get me this." I hesitantly take it. The request form reads, "MRI scan pelvic." Then I ask, "Is this the only option? Can't colonoscopy work?" See, it's human nature to want to stick with what is familiar. Yeah. So he says, that will be the best to start with. So my legs loyally carry me towards the scan zone, while my heart is protesting. Grudgingly, my head joins, and I cry, because I felt that I just did a casual walk in. Why is everything trying to take a serious turn? Moving, but I ask myself, "Doctor, did you do well in your exam?" Daktari kweli wewe. Ulipitako mtihani? Scan done. Traveled back 80 kilometers away. 3 days later, pick my results. The moment of truth inching closer. I remember my husband's words: seek solutions, never complain. And a book whose title is Finish What You Begin. Into the doctor's room with the MRI scan. Results in soft copy. He has his copy ready. We view the images. And there is a black mass. A growth or a cyst? I don't know. At this point, my mind locks. He points to it and says, "This is what is causing you trouble." The black mass, he said, was a cyst, nestled behind the rectum and the tail gut. To me, everything looks normal, because I never did anatomy. Just like your child does a nice drawing, and all you see is a drawing. Only the notes that accompany the scans were long with big, wild medical terminologies. So surgery it is. With restricted movement and long bed rest post-surgery, I had to do fridge restock, batch cook, so everything flows easily after. Hope you understand me, women. Inpatient order form, date booked, excision and sigmoidoscopy, and rectal checks at the same time because of previous issues. Thank God. Successful operation. The cyst forwarded for further investigation. Woke up with pain beyond bearable, pain that I assumed as death pains. Pains that lead to a halt in heart and brain functions. The pain felt as if I crossed over to another world. I passed out. It felt like I had been properly minced and mixed, then successfully flattened by a compact roller. That which compacts roads under construction. So allow me to discuss two other records that I didn't discuss about. That is gratitude journal, which is a record of all things in life that you're grateful for, things you're blessed to have, or obstacles you have handled or steeples you have jumped over. Adversity leads to a state of godlessness with more questions than answers. When you hit the rock bottom, especially in sickness, the gratitude journal acts as a raft to help you stay afloat. The Holy Book, too, serves the same purpose. Another one is an emergency contacts card. Just a simple card titled Emergency. Do a clear name and telephone contacts of at least 5 people. They could be friends or family, but in order of priority. For example, next of kin, that is husband or wife, father, mother, son, daughter, employer, cousin, depending on your preference. When someone else has to help in an emergency and your phone is locked, think about that. Currently recovering, back to our story. Currently recovering, even though it seems slow, all the doctor advised is to avoid being constipated. So stick around for my constipation remedies or hacks to make things flow or just to control your constipation. We'll be doing follow-up scans and will update where and if necessary. The cyst did not have any issues, thank God. My word of encouragement to those looking for solutions or answers: knocking on hospital doors, walking the long corridors, the winding parts, the winding and ending parts. Do not relent. Be your own advocate. And for your children and loved ones, to all mothers burdened in search for answers for your children, my heart goes out to you. Keep moving. It shall be well, and good luck. To my internet family, thanks immensely for your moral support. God's peace. I'm not out of the woods yet, but slowly and steadily, by God's grace, there is progress towards the right direction. An active soldier on the battlefield. This far, I appreciate God's grace, hoping for a brighter, better tomorrow, one day at a time. Peace. If a cat has 9 lives, then I have a few more left. Gear